I'm Dale Smith for Looney Politics, and with hospitals over capacity around the country and the healthcare system being extremely strained, there's a lot of talk about how we reform the system going forward. And everyone's solution is generally more federal dollars, but that needs to come with strings attached. We have to remember that for the decades leading up to the current situation, a lot of provinces spent the time trying to drive efficiencies in their system rather than creating capacity. So most of the time they were running at or near capacity as it was, and when we had things like bad flu seasons, we would exceed that capacity on a not unregular basis. So when it comes to what we need to do going forward, the federal contribution is going to need to come with strings attached. And what that tends to mean is that we shouldn't let the provinces have as free of rein with health spending as they did in the past. We had numerous examples over the past couple of years with pandemic spending when the federal government sent billions of dollars to the provinces, who then either didn't spend it and applied it to their bottom line, or didn't spend it in a timely manner and didn't do anything about their own capacity, whether that was testing, tracing, or ICU beds. As well, during the decade that the healthcare transfers were escalating at 6% per year, provinces were increasing their health spending only by around something like 2.2%, and that meant that a lot of those federal dollars were being spent on other things. Now, during that time period, we didn't see any major reforms to the healthcare system. We didn't have wait times tackled. And when the federal government decided to change the escalator so that it was more in line with actual provincial health spending increases, provinces cried poor, and we find ourselves in our current situation. Now, the Liberals were the only party during the federal election that campaigned on having strings attached to federal funding when it comes to things like outcomes for more family doctors, more training for nurses, more mental health spending, and national standards for long-term care. Provinces are already saying that they don't want these strings attached. They want the federal government to contribute as much as 35% of all healthcare spending in the country. But I'm not sure that the public is ready to trust the provinces quite as much as they used to be. The pandemic has laid bare a lot of the problems that the provinces have had in terms of their healthcare spending and the way in which they have organized their systems. And I think the appetite for no strings attached may be coming to an end. I think the federal government is going to insist on a lot more strings going forward, and there may be a battle with the provinces, but I don't know that public opinion is going to be on their side. For Looney Politics, I'm Dale Smith.